My name's Andrew Peel. I'm one of the endocrinology registrars at the Royal Adelaide Hospital and the Queen Elizabeth Hospital, and this year I'm undertaking the Andrology Fellowship focusing on men's health. So metabolic health is essentially what we put into our body, diet, and then associated exercise and the overall effects of these on our general health. So one major issue that's occurring across the world at the moment, more so in men than women, is the obesity epidemic. If we look at Australia in particular, up to 70% of men are affected by overweight or obesity. And this has significant impacts on day-to-day activities, as well as multiple medical issues such as high blood pressure, high cholesterol, diabetes. And I'd like to also add in obstructive sleep apnea, which is commonly associated with these conditions and impacts each of them to make them worse. Obstructive sleep apnea is a condition that's characterized by episodic blocking of the airway during sleep. And it's typically due to multiple factors, but one being increased weight around the neck, resulting in, when we fall to our deeper stages of sleep, blocking off the airway. Obstructive sleep apnea is actually a quite common condition. More recent studies, both across the world and in Adelaide specifically, have shown that the rates of obstructive sleep apnea affect up to 50% of men. Of that 50%, half of them had moderate to severe disease, which is essentially the level that we would recommend treatment or significant treatment. So common ones that we find will be that someone will wake up in the morning with a headache or wake up with a really dry mouth. They often have underlying erectile dysfunction, as well as that they get up in the middle of the night multiple times to go to the toilet. As you would expect, if someone's not sleeping well, then there are the common ones, which will be that you will fall asleep in traffic or at a traffic light, or you will fall asleep while sitting in a chair whilst relaxing. In the majority of cases, weight loss is one of the major treatments of obstructive sleep apnea. And when I say in most cases, there has been evidence that obstructive sleep apnea is not limited to people with obesity. In fact, the study that was undertaken in Adelaide, looking at over 1,000 men, showed that 14% had normal BMI and yet had obstructive sleep apnea. Weight loss aside, there are other interventions that can be undertaken, and it depends on what particular subtype of obstructive sleep apnea are present. For example, if you only get apneas when you're lying on your back, then there are different tools that can be used to prevent you from lying on your back when you're asleep, thereby preventing you from having the episodes of airway blockage. If you are able to tolerate, then we typically recommend what's called a CPAP machine, which is a mask that provides extra pressure down the airway when you're asleep, and thereby keeping the airway open, allowing you to sleep properly. We've recently released an article in the Journal of Urology and Men's Health that have provided a small review of the complications of obstructive sleep apnea. However, it is a very common condition and further advice can very easily be sought from anyone's general practitioner.